готова ли система здравоохранения и способна ли она принять то количество пациентов, которое будет возникать.
Is our system ready for new challenges? This is an important question. The personnel, the virus that came from China, from Wuhan, we saw the TV documentaries about the high number of patients and about the hospitals that had no place for everyone. That's why we are asking this question. Is our national health system ready for new challenges? From January to March and April, we did a lot in order to retrain our healthcare professionals and buy the necessary equipment. I would like to now talk about not what we had a year ago, but turn to the key documents, laws and decrees, and let's look at what we did in the previous years and on which the development of current health system is based. First of all, here you see the national development goals of Russian Federation up to 2030. The program was enacted by the presidential decree of July 21st, 2020. So we have to preserve our population, its health and well-being. We have to also focus on digitalization, digital transformation. We understand that ensuring the conservation of our population and preservation of its health and ensuring the population's well-being is to be ensured by ensuring the sustainable development and sustainable growth of the population of the country, increasing the expected life expectancy to 78 years, reducing the poverty level twofold as compared to 2017, and increasing the share of citizens having physical activity and going in sports up to 70%. And digital transformation, which is also very important for the health system. Here are the threats of national security in terms of healthcare. And this was described in the strategy of health system development in the Russian Federation up to 2025, enacted by the presidential decree of June 6, 2019. Number one, high level of non-communicable disease morbidity, high incidence. At the same time, we have this reduced. Children, when they are born, they come healthy into this world. The infant health, we are preserving it well over the past years, and when we grow up, we ourselves create certain factors which shorten our life. And this, first of all, starts with our adolescence. And we know we have a high incidence of drug addiction, alcohol addiction, HIV, viral hepatitis B and C, tuberculosis, trauma incidence is also high, as well as poisoning. We understand the situation is far from being ideal in terms of this, At the same time, we understand there is still a risk of various biological or other technologies that may be used against the population and are also a hazard. Another hazard for national security in terms of health system is the outflow of highly qualified health professionals from public health system to other systems. We have spent a lot of effort and funds and time on educating healthcare professionals. It may be 6 years or more, residency and so on. So, of course, our most valuable resource is healthcare professional. And it is a hazard to national health, national security when these highly qualified, well-trained health professionals are migrating from public health system to other areas. What else is spread of antimicrobial resistance? The increase of epidemiological significance of opportunistic infections and others. And this means that we need to cope with a certain mismatch. There are two mutually excluding processes. On the one hand, the infrastructure is growing. On the other hand, we see the healthcare system, organizations and establishments are changing, new equipment is brought, and so on. And at the same time, the growth of infrastructure and satisfaction of population, which is declining, this is the mismatch we have to tackle. Now, new challenges. The main challenges we faced last year were communicable diseases, which means that we need to focus especially on development of our sanitary and epidemiological surveillance system. We need to develop the action plan and algorithm for preventing emergency situations related to spread of dangerous communicable diseases. We need to ensure medical services and medical aid in case of risk of spread of communicable diseases, and we need to modernize the infectious diseases hospitals. But at the same time, we have another challenge, which is non-communicable diseases. Their incidence is growing, which means that we need to provide the necessary medicinal products, personal protection equipment to be available. We need to do all to avoid shortage of medicines and PPEs. And the question is, how can we organize and create this resource we need for collection of data and to control the process? And this is what we needed before and what we still need even more now. And of course, I'm talking about the digital transformation of the health system. And when we talk about assessment of all the non-communicable disease challenges, we have to remember about the socially significant diseases, the diseases that are independent of the lifestyle. I'm talking about cancer, autoimmune diseases, and a number of others, which are also new challenges. And now, as you know, most vulnerable patients are patients with diabetes mellitus and obesity. So in this particular period, the role of non-communicable disease control has also increased. Now let's talk about the strategy of development of Russian health system for a period of up to 2025, which is prescribed in Presidential Decree of June 6, 2019. The health system development goals in Russian Federation are increasing the population of the country, increasing the lifespan of our population, increasing its well-being, and not only. And we have done a lot even before. And especially now, we implemented a number of federal programs like Zdarovye, health, national program, implementation of a system of childbirth certificates, plus health system modernization programs that we implemented in 2010 through 2012, as well as construction of high technology centers, which started in 2006 to 2018, which was also important for prevention of disability. And of course, in Russian Federation, we had a very large-scale program for construction of perinatal centers, which lasted 2012 to 2019, which by 40% reduced the infant mortality. Of course, a lot depends on the way the pregnancy goes, depends on the risk factors a pregnant woman has, and now with the new perinatal centers we built, we can really be proud of this reduction of infant mortality. Now, answering the new challenges. Of course, we have spoken about the development of the sanitary epidemiological surveillance system. And on December 30, 2020, the Russian government issued a new decree number 3680-R about the development and strengthening of the federal state sanitary epidemiological surveillance system in 2021-2028. This is important from the point of view of treatment, of diagnosing, and other aspects. Of course, we need to develop specific prophylaxis tools and systems. And of course, in this period, we were really happy to have the platform solutions we developed for other diseases, and which helped us to achieve a quick effect, because efficiency and safety is what matters most in such things. And the platform we have for various dangerous communicable diseases really helped us. And the new technologies, implementation, integration in our healthcare system, as well as prophylaxis of various emergency situations, is what we currently have. On January 4, 2021, the Russian president issued another decree on development of the algorithm of action for prevention of emergencies related to the spread of dangerous infectious diseases. And this is a three-tier system. In 2020, we faced the pandemic development of the new coronavirus infection, and we realized that our response to the new emerging challenges should be much quicker. And we saw that in real life last year. And we saw that we could make it. And in order to find a solution in just a month or so, it really requires agility, flexibility, rerouting of patients, rethinking the whole system. That's why the presidential decree of July 2nd, 2020 suggested a completely new, outstanding solution for the healthcare system. This decree states the temporary protocol of healthcare provision and guidelines. It was based on two documents. First, on organization of healthcare services, and second, on treatment. And second is mobilization of the wards and beds. And now we have a new term, hospital bed of double purpose, which means it can be reformatted and used depending on what is currently required. And it took us very little time to ensure the readiness of our hospital wards with the number of hospital beds we can now use as we need them, plus mobilization of healthcare professionals. Healthcare professionals, independently of their specialty, which have undergone a short-term training, additional professional training, in the framework of professional programs, helped us in just a few weeks to train more than 1,400,000 healthcare professionals. Also thinking about the safety of our healthcare professionals, we taught them how to enter properly the red zone in COVID hospitals and how to safely exit the red zone. What drugs should be taken, how the healthcare professionals can protect themselves, and how they should best treat the patients. And of course, at a certain moment of time, we had 1,200,000 patients. I remember there were 230,000 people that were casualties in Hiroshima, for instance, and we understand how difficult it is to cope with such figures. At the same time, we opened federal telemedicine centers. Some experts had already experience of COVID-19. At the other end of the country, there were doctors who have never had any patients with COVID and had no experience. So doctors, via telemedical communication, could help their colleagues all around the country. Of course, we need to very well understand and visualize how we want the new system to work, especially now that we are facing a pathogen which cannot be traced directly. You could be in touch with an infected patient for a few days without knowing that, without feeling anything. Plus, the pathogen did not always cause the severe form. There is a lot of people who have had a symptomatic course of COVID, and we did not have any weapon against this, either to prevent or treat. We had no drugs for COVID-19, and this means we needed to ensure different organizational models. If we had sporadic COVID cases, we needed to break the chains of infection. When the epidemic propagated, we needed to focus on inpatient treatment, but the inpatient treatment is always limited by existing capacities. At the same time, in parallel, we were designing the drugs for specific prevention, and now it is an outpatient management model. So, answering the new challenges, we see the modernization of the communicable disease control services. And this is not just about development of microbiological laboratories, about protection of personnel, provision of MRI and CT scanners and other equipment, but also other aspects are being tackled. So once again, this is a multi-layer system. We need to have infectious diseases units in healthcare organizations, plus we need research, medical, communicable disease center to be the head of the pyramid, plus the Ministry of Health communicates using the system of immediate response to new challenges. We have a new telecommunication algorithm. We also have mobile hospitals available, which the All-Russian Center of Medicine of Catastrophes will be operating, and this will be available for any emergencies, including road accidents, environmental accidents, and others. So the response model is being transformed already now, today, and talking about the management of the threat of a new communicable disease, we have a scenario which really helps first diagnosis using the a quick test system development, express test development, plus we have the necessary capacities for production of the test number we need, and treatment is another pillar in the system, which means development of medicinal products for prevention and treatment of specific complications of new communicable diseases, development of technologies for production of monoclonal antibodies for immune therapy, and development of specific therapeutic drugs for new communicable diseases. And prophylaxis is pillar number 3 in the system of hazard management and monitoring. Of course, monitoring now means much more than yesterday. We have automatic analyzers in public spaces and the national borders. We have national banks of blood serum and collection of microorganisms, and we have applied mathematic models of spread of infectious and geoinformation systems that help us trace the spread of the pandemic. And the current period is one of the key moments for the treatment and availability and affordability of treatment is very important. We need to remember about quick access to the medicinal products which are important for improving the quality of life, mitigating the complications, and preventing new serious communicable infections. And two new decrees of the Russian government were enacted last year in April and March. One about the improvement of access to the medicinal products market, and second is improvement of access of medicinal products, medicinal devices, medical devices to the market, with a key goal to ensure availability of all we need to counter the new threats and challenges. Digital transformation of the health system, both for the healthcare organizers and for patients and for healthcare professionals. It was very important to develop a network of national research centers and implementation of innovative medical technologies in the framework of federal projects. And while combating communicable diseases, over the past year, the Ministry of Health has adopted the largest number of healthcare improvement-related documents. Now we have two novelties, two new editions of the program, including the one for improvement of healthcare for cancer patients, which is being rolled out across the country, plus digital transformation of the system of health insurance in the framework of mandatory health insurance. And let me give you a couple of examples of the projects the Ministry of Health of Russia has implemented in healthcare system over the period. Let me start from medicinal products provision. We changed the provision system, and from 1st of January 2021, all the drugs provision is being carried out based on a completely new system which was developed jointly with other governmental agencies, and today the provision is based on uniform parameters which really influences the price and the speed of provision. What else? Labeling of medicinal products. The system could not withstand the overload, and we had to reformat it. Yet now the system helps us see, for instance, how the guidelines are being implemented. We need how many patients with certain health issues we have. We know how much medicinal products have to be used for these patients, and we can compare the actual situation with what it should be, and we can this way improve the result and improve the system, for instance, in cardiology and oncology. One of the projects in the framework of the existing projects is creation of the unified public information system in healthcare. And I also spoke about these vertically integrated medical information systems for cancer patients, for cardiovascular patients, for the newborns, for instance. And of course, the system is now more patient-oriented, with focus on the mandatory medical insurance. And the system should include all the necessary pillars, such as sanitary aviation, ambulance service, central Republican, regional hospitals, and others. And now, answering the challenges and threats to national security in healthcare system, we have the following goals. Number one, creation of conditions for increasing the availability and affordability and improving the quality of healthcare. Number two is prevention of diseases in primary care, first of all, and polyclinics, and so on. Goal number three is development, implementation, and use of new medical technologies and new drugs. Goal number four is prevention of spread of diseases, of communicable diseases, highly communicable diseases. Goal number five is improving of the system of control in health protection system, and goal number six is ensuring biological security in the country. So we have to, like I said, improve the control system. And this year, by the way, we will have a new law on control in the healthcare system in our country, and our ministry participated actively in developing of this document, and we have new risk-oriented approaches. And this law is now very efficient in terms of control and biological security. Like I said, we have this law signed by the Russian president in 2005. So in general, we can say that the transformation of the healthcare sector, which is focused on reducing the risks and tackling the hazards to the national security in healthcare, we can say that national projects are the ones around which all the changes will take place. And finally, to wind up my presentation, I would like to say a few words about the transformation of public service. We live in a quickly changing world. And this evolving world makes all of us, each of us, very carefully forecast the future. We need to be able and ready to change quickly, but you can do that only provided you receive information in real time online. And this, dear friends, means the speed of transformation. So the speed of data provision, collection, and processing is of utmost importance. And then, if you have this, you can change the whole system of healthcare services provision. You can reorganize it. You can assess properly the efficiency of the system. And of course, only then you can improve it and ensure high quality of healthcare. That's why the public service transformation in healthcare is, first of all, focused on increasing the speed of data provision, processing, and analysis in healthcare.